Hip pain is much more common than you think, and it's oftentimes much easier to deal with than you think. This is Dr. Lou Jacobs. Thanks for joining me on my morning commute, where I'm going to talk to you about hip pain and hip dysfunction. There can be a number of causes, so needless to say, if you're going to get the best care for your hip problem, you need to have a solid idea of what's going on in there. Whether it's arthritis or whether it's something more serious like a tumor in the head of the femur, if there is something going on structurally that puts the hip joint in a bad position so that it's rubbing poorly or it is moving poorly and causing inflammation in ligaments and tendons. You got to figure out what's going on. So as far as non-invasive treatments go, okay, because I'm assuming that you wouldn't be watching this if you were looking for surgery. As far as non-invasive treatment goes, there are a number of great options. Sometimes hip problems are actually stemming from problems in the feet. So believe it or not, I've had a number of patients who have had foot issues that once corrected with orthotics have actually corrected the hip problems too. It could be something as simple as that. It could be that you just have a tendonitis in the hip from sitting too much, all right, or walking up too many steps, and it's really nothing to be terribly concerned about. You do the right things that I would tell you to do, and you're okay. It could be something more serious like arthritis, degeneration in the joint, that while it cannot necessarily be corrected without surgery, it can be managed without surgery, gaining you time and keeping you in the game until you need something more significant. And with any luck, and by significant I mean surgery, with any luck, you can avoid that altogether by managing things properly. So identification of what's going on in the hip. Coming up with a plan that does not involve regular injections, surgery, you've basically got a couple of options with hip pain, right? You can either try to manage it through medications or manage it through non-invasive procedures. And then of course the other option is invasive procedures. Nobody woke up or wakes up in the morning wishing that they were going to have hip surgery that day unless the problem has gotten really, really bad and there are no other options, in which case surgery is great. But until that point, non-invasive is the way to go. Non-medicated is the way to go. Do you realize how many risks there are associated just with over-the-counter painkillers? The association with heart disease, heart attack, and stroke, it's so high that most medical establishments are recognizing it and suggesting that you minimize the intake of things like aspirin and ibuprofen because they are so dangerous. So my suggestion to you is, again, have the hip checked out, find a non-invasive solution, manage it as long as you can, and know that there's hope out there. You don't have to be hopeless, but you do have to do something, and we can help you choose the right path. Give me a call. My name is Dr. Lou Jacobs, and thank you for joining me on my morning commute. I do this every morning when I go to work, and hopefully you can find some help with the knowledge, expertise, and techniques that we have at our disposal for you under these circumstances. Have a great day.